Hola, buenas noches. Eso es Perfil Latino, el programa de la comunidad para la comunidad. Estamos con ustedes de nuevo y gracias por acompañarnos en el Facebook Live de Perfil Latino. Hoy vamos a tener un invitado muy importante de la comunidad. Se trata del señor James Curtis Edwards. Vamos a traerlo un poquito más adelante. Pero primero vamos a hablar de los números del coronavirus a nivel global, Estados Unidos y Cumberland County. En New Jersey nada más tenemos 140,743 casos, 9,508 muertes. En los Estados Unidos, en todos los 50 estados, tenemos 1,358,000 casos, tenemos 81,650 muertes. Eso es hasta el día de hoy. A nivel global, son 4,233,504 casos, 289,932 muertes. En Cumberland County, donde vivimos, es Bridgeton, Millville, Violent, tenemos 1,365 casos y 40 muertes. Esas son estadísticas del Johns Hopkins University Hospital, de Bridgeton Chamber of Commerce, y esos son los que tenemos hasta ahorita. Siempre les vamos a recordar que tomen las precauciones, la cosa todavía no acaba, y entonces pónganse su máscara, pónganse sus guantes y mantengan la distancia social. Bueno, hoy vamos a hablar de pruebas. Today we're going to talk about testing and CompleteCare, and that's why we're inviting Mr. James Curtis Edwards. He's the CEO and president of CompleteCare. So let's bring Mr. Edwards here. Curtis, good evening. How are you doing today?
I'm doing great. How you doing, Harry?
I'm doing good. I know you've been busy. You're still in your office at that late at night. So that means you're working hard for the people.
That is absolutely right. We are doing the best we can here at CompleteCare to service our service areas, of course.
All right. So, well, you know, CompleteCare is very well known in the area. Can you tell me how the centers are readjusting services due to COVID-19? I know you had 21 centers, but now you had to close some. How's the readjustment doing for you?
Sure. So CompleteCare had, 21 health centers spread throughout Cape May, Cumberland, and Gloucester County. Since March, we have reduced our footprint down to 8 locations. We still have health centers in all 3 counties, but we have consolidated to help reduce exposure for patients and staff. There are number one concerns during this pandemic. This has also helped us conserve, supplies like masks, cleaning supplies, gloves, and hand sanitizer, all of which are in short supply right now. So everything we do, is of course to allow us to be able to continue to service our service area right now, Harry. So, supplies is hard to come by. So we had to do this, go down from 19 to 8.
Okay. En general, lo que nos platica el señor Edwards es que CompleteCare tenía 19 centros, pero tuvieron que disminuir, reducirlo a 8. Eso es para poder maximizar sus posibilidades de poder servir mejor con el COVID-19 y también para tener más todos los equipos PPE que necesitan, máscaras, guantes, todo eso para que tengan suficientes. Very good. So now there are a lot of talks about testing, as a COVID-19 testing center, because you have been chosen to be a testing center. We were talking with Emma Lopez a couple of weeks ago, and she was informing us that CompleteCare now is a testing center. Well, please explain to us how it is working and what is the testing capacity.
Sure. So testing is, as you heard from the governor today, is very important. You got to do the testing first, followed by the contact tracing. And Harry, let me know, because I know you got to translate, so I don't want to go too far ahead.
That's okay.
All right. So we, of course, testing goes with contact tracing in order to open back up the state. So this is a much needed process that we have to do. So we're working with a lot of great partners in testing. In Cumberland County, we work with Cumberland County Health Department, the Violent Health Department, the County of Cumberland, and a few other folks to conduct drive-through testing in Cumberland at the college. And then Cape May, we work with ourselves. We conduct testing down in Cape May County at our courthouse site for Cape May County residents.
So, lo que no, hay diferentes sitios para las pruebas, entonces hacen las pruebas en Cumberland, en el área de por acá, pero también en Cape May ellos hacen pruebas también, pero también hacen partnership, o sea, colaboran con otras organizaciones también, como el Violent Health Department y el hospital también. Entonces tienen lugares donde se hacen como si fuera drive-thru testing. Pero, but what is the capacity, Curtis, of testing? How many can you handle every day? Do you have an idea?
Oh, definitely. So I wasn't finished. I was just stopping there just to go over the locations, you know, and another partner, of course, is the sheriff's office. I mean, I don't want to forget them because, you know, we definitely need the sheriff's office out there. But these sites are by appointment only. And the process to get tested is very easy, Harry. They visit CompleteCareNJ.org and request a telephone screening for COVID-19. So once they request that, from there, you can talk to a provider on the phone, which is one of our physicians, who can see if you have symptoms or if you have been exposed to someone who has tested positive. If you needed to be tested, someone will reach out to you to schedule an appointment and location of the testing site. Now, the capacity is simple. Right now, you know, there's always a limited supply on the test kits. So we're doing close to 500 a week right now in Cumberland County and only 50 down in Cape May.
Oh, okay, so él nos explicó la manera de poder adquirir una prueba es que llaman a este número. Ustedes pueden ir a CompleteCare.org y hay que hacer una cita. Y a la cita, después de eso, alguien, un doctor o una enfermera le va a hablar y le va a dar entonces lo que se necesita, si es que tiene síntomas, si es que realmente necesita la prueba. Now, what about, and also él dijo también que el departamento del sheriff del condado también están ayudando también en eso, no hay que olvidarnos de ellos. So Curtis, what about family members? When we talk about family members that have been exposed to somebody who is infected, what is the criteria for them to be tested?
Right now, the criteria changes, day by day. So of course that criteria has changed to anyone now, not just family members. So if anyone has been exposed to someone who has tested positive, they now can get a test. They go through the same process. They can go through our website, COVID-19, request to be tested. Our provider will call them and then give them the date and time and the location of the test site.
Oh, es muy importante porque ya nos explica que cualquier persona que piensa que ha sido expuesto a un contagio puede contactar a CompleteCare, puede ir al sitio web, a la página web, es CompleteCare.org, o puede hablar a este número, dice que necesita una prueba del COVID-19, le van a hablar de vuelta para que le den una cita, para que le digan a dónde se va a hacer la prueba. Muy bien. So now, your center service the undocumented and also the farm workers and also people without enough insurance. What do they need to get tested? Is that the same process or do they need to have a different process?
Okay, so CompleteCare helps anyone in the community who needs us for healthcare. I mean, we've been around for going on 50 plus years. We're here to service the community, and in the community includes our migrant and seasonal, agriculture workers. That includes those that also who has insurance, who has Medicaid, who has Medicare, and those who are uninsured. We also, as you know, serve a huge number of migrant and seasonal farm workers each year. So I'll let you go through that, then I'll go into the next part.
Él nos explica que pues, ellos reciben a todo mundo, o sea, si tienen seguro, si no tienen seguro, si tienen Medicaid, si tienen Medicare, si son trabajadores agrícolas, si son personas sin documentos, ellos CompleteCare sirve a todo mundo.
Yes. So this week we started doing some COVID-19 testing right on the camps. Our teams will be going out and offering the test in a way that is convenient for the farm workers and require little time away from the camp. So to get tested off the camp, anyone who is undocumented can follow the same procedure as I mentioned above. Visit our website, CompleteCareNJ.org, or call 856-451-4700. All call center staff can assist them with getting a test scheduled.
Oh, but this is good because now you're going to go locally. You're going to do at the camp. Actually, when does that start? Is it already started?
We started today. We went to 2 nurseries, both in Cumberland County, 1 nursery and 1 packaging plant. So today, I think we tested over 150 people.
Oh,
so we try to make the paperwork minimal that needs to be completed. But we do need some information filled out by the employer. So any farm owner, packaging plant, our employee can call CompleteCare to schedule us to come out.
Oh, okay. This is very important because cualquier persona que tiene una nursery o que tiene un rancho donde tiene empleados, si piensa que es necesario que deben de hacer pruebas, pueden hablar a CompleteCare. El número aparece en pantalla o pueden ir al sitio web. Es CompleteCareNJ.gov y ahí pueden solicitar una prueba. That's very good. So I didn't know that was starting today, but that's really good. So now, when you talk with your physician and nurses teams, what are they telling you about cases of COVID-19 they have seen lately inside of CompleteCare?
Okay, well, we do a lot, Harry. We are pre-screening everyone who comes into our office to make sure they don't have any symptoms of COVID-19. That was the first thing we initiated, was screening everyone that comes into our facilities. Our goal is to make sure anyone with symptoms basically stays home. So if you have a cough, you have a fever, we tell you don't come to work, stay home. I think that's the most important part, stay home. To help with that, we are offering visits by phone and televisits. So we have telephone visits where we can call you, and we have the video and telephone, which is telehealth. So those are ways we are helping not only our staff, but our patients also. They are safe and secure and let patients talk with their doctor from a safety of their own home. So they don't have to come in. We can do these visits by phone or telephone at the moment.
Oh, this so no, si alguna persona está enferma, primero necesita quedarse en su casa, puede hablar a CompleteCare, lo pueden hacer teleconferencia. Si quiere decir que el doctor o la enfermera, el doctor más bien lo va a consultar desde el teléfono. Claro, van a discutir sus síntomas y van a ver si necesita ver a la persona o no. So, well, this is good, but have you seen cases of COVID-19 that you have tested? Do you have an idea or not?
Yes. So while we aren't seeing a lot of cases of COVID-19 in our sites, we are definitely screening a lot of people. As I mentioned earlier, I believe along with our partnership, we've tested over 1,800 people since we started testing and talking to a lot of people with symptoms over the phone. And I believe the number that's coming back is at least 40% of the 1,800 test positive for COVID-19. So of course, when you test positive, there's the whole procedure that happens afterwards where you got a shelter in place. And then there's a process to find out who that person has been in touch with, which is known as contact tracing. So like I said, 40% of the people we tested so far has come out positive. So we're seeing an increase in cases in South Jersey, but while other areas of New Jersey are seeing less, it is really starting to pick up down here, which is expected.
So él nos explica que 40% de las personas que han hecho la prueba en CompleteCare han salido positivos. Entonces lo que tiene que hacer tiene que poner a esa persona en cuarentena y también tiene que rastrear los contactos que ha tenido esta persona, más o menos para ver con quién estuvo en contacto, quién ha infectado. Es muy importante. Curtis, tell us, when they do the telemedicine, is that the same number they need to call, or there is a different number for the telemedicine?
Yes, when we set you up for the telemedicine, first you got to call the 451-4700 number or go through our website, the CompleteCareNJ.gov. Then when it's time for your appointment on telemedicine, there will be a link sent to you in order for you to click on that link to be part of that video. The telephone is the same numbers.
Okay.
Just there's a process that they will go over with you once they touch base. But 451-4700 is the real number you have to memorize now to call in order to get those 2 visits started.
Okay, and then when they send you a text, they send it to your cell phone?
Yes.
Or to your cell phone?
They will ask you what you have. It can be by cell phone or it can be by computer. It all depends on what capability you have for the telehealth or telephone visit.
Entonces, para contactar a CompleteCare, es importante que ustedes memoricen ese teléfono 451-4700. Estaba yo hablando apenas con el señor Edward y nos dice que el teléfono está funcionando bien, no deben de tener mayores problemas, o si no pueden ir directamente al website de CompleteCare, donde pueden solicitar una consulta por teléfono, por teleconferencia, por videoconferencia, y entonces ellos les van a decir lo que tienen que hacer. Bueno, Curtis, are you planning for more testing, or how do you see the future of testing at your site?
Well, of course, as you heard the governor today on his during his press conference, he said one of his goals, of course, is to increase testing throughout the state. So that includes Cumberland County, that includes every county we're in. So I believe that number by the end of June, he expects the testing to be close to 30,000 tests completed a day. And that's not by us. We're just part of a system that's going to offer as many tests as we possibly can, of course, if it's available to us. So we're open to testing whatever, whoever, whatever, wherever we have to in our service area, which is in Cumberland, Gloucester, and Cape May County, as long as we have the test, staff, and of course, the resources to back us.
Okay, so yeah, so CompleteCare va a seguir haciendo pruebas, como cada vez van a aumentar para más pruebas, y eso es muy importante para nosotros, que sepamos que CompleteCare va a tener posibilidad de hacer más pruebas. Bueno, finally, before we go into comments, as a healthcare executive, what are your recommendations to the public in this pandemic? From what you see, what can you tell somebody not to do or what to do in this pandemic?
Well, first, let me start by congratulating the team I have. You know, we have a great doctor who is our chief medical officer at CompleteCare, and she has been advising me, myself, and my staff of the following. Because as you can imagine, you know, we're all non-compliant when it comes to this pandemic, but there's some important things that everyone has to remember. And the first thing, of course, is to stay home if you are sick. Continue to social distance. Stay at least 6 feet away from others at all times. Wash your hands often. Wear a mask whenever you're around others who you do not live with. Clean surfaces like phones, doorknobs, countertops, and other things that get touched a lot and often. I know it isn't easy, but we have to keep this up for a while longer to really stop the spread of the coronavirus.
Okay, so son las mismas puesto el CDC. Lo que nos dice también el señor Edward de CompleteCare es que ustedes, si están enfermos, quédense en su casa. Claro, contacten CompleteCare para ver si no necesitan una consulta por teleconferencia. Y luego, pues, mantengan su distancia, 6 pies entre personas que no conocen, que no viven con ustedes, lavarse las manos frecuentemente, ponerse su máscara y, pues, si tienen cualquier problema, tienen que acudir a su doctor. So, es muy importante que esas recomendaciones sigan las recomendaciones de la jefa médica del mismo CompleteCare. Bueno, pues, Curtis, this is very good information. So now we're going to go into some comments because some people that are looking at us, they may ask some questions. So let's put those questions here. Let's start with comment number 1. Is Kathy there to put the comments? No. Okay. So, Emily.
That's Emily.
Emily Paul is saying, what's Emily Paul is saying is? Okay, we're coming back soon. Emily. Emily's just saying, she's sending applause for you. Let's put together here. Edna Ortiz Morales, she's saying, saludos desde Puebla, Mexico. Somebody in Puebla is looking at us. She says, saludos. We say hello. And then also, Claudia Trout. You say hello, Curtis. So that's for you.
Hello, Claudia. Hello, Emily, Tiana.
And then, yeah, Tiana. Tiana say hello, everyone. Okay, there's another question. Luz Batista. She's saying, good night. My question is, 1 week I call and the center needed to take my blood pressure and they don't take the call. What can I do? That's what I was telling you at the beginning. Sometimes people have a hard time getting to that number. But with
now, of course, when we had 19 locations, that was still one of our, one of the things I always want to see improved is, of course, when someone calls the 856-451-4700 number, I would like them to be able to talk to a live person within minutes. So when I hear that, it's upsetting that someone calls and they can't get someone. But there is a technology world out there, and sometimes you get thrown into a loop and you get lost in space. So all I would say is keep trying. Sometimes when you call and you don't get no one, hang up and try it again. And sometimes it goes right through, or most of the time it goes right through. But what we need is, you do get through, to tell the person on the other line what happened, so we can trace back, because we can trace the number and find out what happened during that call so we can fix it.
Okay, so el consejo es que sigan llamando y que, pero también maybe they can also try the website if they have an issue with the number. Sometimes, some area we don't know, but that's your main number. It should work. Okay. Another. Let's say another comments here. What's going on?
Hey, what's going on, Tammy?
Tammy Teddy. Good evening. Thank you, Curtis, for your continued support to the community. So what's Tammy? Good. Okay. Well.
And what I did do also, Harry, I got a picture of this, of what the kit looked like. This is what the kits look like. You hear a lot of rumors that what they're using, sometimes you stick it in your nose and it goes to the back where your brain is. That's not true. The new ones that they got out looks like this. They just swab your nostrils, on both sides, and they put it into this and send it off, and you get your results within 3 to 4 days. So
all right. Okay, that's good.
Approved.
That's good, because I look a lot of CNN, and the Dr. Sanjay Gupta, they make the test live for him, and they had to put that all the way to the back of his nose. So, and then he was kind of saying, "Oh, no."
Yeah, they have two types. So I can tell you here at CompleteCare, we have both, but this is the one that we're using now. So you can see how small that is. It's not reaching the back of your brain. I mean, it's impossible.
Let me put that here. Yeah, good. Yep.
Impossible.
That's good.
Compare.
Never say hello, and that they're putting the kid over here. Okay.
Hey, tell Nelva. Hey, how you doing, Nelva?
Nelva say good job, excellent.
Great.
Oh, there's some more. There's one more coming up. Mary. Oh, come on. Where is that coming? All right, Mary Torres. Good evening, Curtis. This is Mary Torres, good old friend of Jean Bassa. Good job watching from Merritt Island, Florida. Oh, from all the way Florida, eh?
Oh, nice and hot down there, I hear.
Okay.
Thanks, Mary. What's going on, Carmen?
Carmen Susini, hello, Curtis. Okay. Well, and I guess the important message is that they can call CompleteCare. They don't have to worry about anything. They'll get the service, and then this is good.
We have the trust of the community. We've been here for over 50 years. Whatever we would do to make sure everyone get tested, Harry. I mean, you have my number, you have my email. If there's a way they can get that message to me, we'll make sure it's taken care of. And if anyone has, which is hard to get, PPE, let us know, because we're looking to order. We want to make sure our staff have all the necessary PPE to continue on our mission. Okay.
Well, thank you very much, Curtis, for being here today. I know it's late for you. You're still in your office. You need to get some time to go to your family too.
Right. They know this community is my family also.
All right, that's very good. So hold on a second. Let me say goodbye to the show, and I'll come back right with you for a minute.
Okay.
Yeah. So what we had James Edward Curtis from CompleteCare. Él nos explicó muy bien que no tiene que tener ningún problema. Contacten al CompleteCare. Hay posibilidad de hacer pruebas para el coronavirus. Entonces, se pueden utilizar el teléfono directamente o utilizar su website o utilizar también teleconferencia. Así que, pues, eso fue lo que hicimos para ustedes hoy. Muchas gracias por seguir con nosotros. Eso fue Perfil Latino, el programa de la comunidad para la comunidad. Buenas noches.